So, good afternoon, Chris. Thank you for joining me. This is the fifth day, part of the Men's Health Week. And today we're going to talk a little bit about mental health and also suicide around men. So, if you could first of all, obviously, just introduce yourself and tell us what you do in the council and how long you've worked for the council.
Okay, hi Lucia. My name's Chris. I work for Blackburn with Darwin Adult Learning, and I've actually been with the council now for I think nearly 16 years. But for the past 5 or 6 years, I've worked as a community development tutor, predominantly focused on well-being. So working, teaching a range of courses designed to help people support their well-being, and also courses such as the mental health first aid courses, which are there to help people feel more confident to be able to support others if they're struggling with their mental health.
Yep, I've been very fortunate. I've managed to do two of those, three, in fact, three of those courses with you. They were fantastic. The mental health first aid was definitely my favourite. I'd say that definitely gave me some kind of top tips on how to deal with my mental health, especially throughout the lockdown. That was quite difficult. And you introduced me to the 5 ways of well-being, which I love. I apply that now in pretty much my everyday life. But for you, Chris, throughout the kind of past 18 months, how would you say that your well-being and your mental health has been affected?
Yeah, I think it's fair to say I didn't sort of cope particularly well right at the very start of when COVID first hit. I was quite anxious for myself and my family, particularly around this new and unknown virus. And I found myself spending way too much time on social media. I was following every news report. I was constantly refreshing Twitter. And it made me incredibly anxious because I was just reading and taking in all this information um, that wasn't really good for my well-being. So I think after a week or so, I've reflected and realised that it was becoming way too much for me. And I actually came off social media for about a month, I think it was in the end. And I restricted myself to watching the news once a day, and just actually gave myself that space and recognised that actually, for my personality, constantly reading stuff was really not helpful at all. It was making me quite unwell. So it was good that I recognised that in myself, and I was able to kind of take some action to kind of address it and things like that. And I think it probably still stands true now that I recognise if I'm kind of getting a bit too involved and engaged in the information, and find myself preoccupied or worrying about it. I just find I need to take a bit of a step away and perhaps have some downtime, um, get outside, get some fresh air and things like that. So I think generally as it's gone on, I feel I've begun to cope better. And I suppose, like anything, I've learned new strategies and things to be able to support myself um, as time's progressed, really, which I think is probably common for a lot of people have had to find new ways to deal with very changing and very different circumstances to what we've been used to from normal life.
Yeah, definitely. And would you say your workload increased throughout that time? Did you see a higher demand for education around mental health?
Yeah, I think initially we were sort of, because traditionally a lot of our courses were all face to face, and obviously at the beginning of the first lockdown, we just were sent home and we had to learn new ways of working. So initially, I think we started to develop some of our own resources on our website, things to help people to either be able to occupy their time or to have a distraction. We also, I think we contacted nearly every one of our learners by telephone, like as a well-being check-in call. And particularly for us who've been working with people who have been experiencing issues around stress or anxiety and depression, I think those calls were really important to make just to check how people were. We also obviously let people know about the Wellbeing Hub that was being set up in Blackburn, so it was really useful to be able to provide that information. We also got involved in some of the Wellbeing Hub calls for a short time as well. And then gradually, as time's gone on, we recognised that we were going to have to take our delivery online, and there was a massive learning curve for all of us. I was quite fortunate, and I think I'm probably one of the more digital savvy members of the team, so I was actually helping other colleagues to kind of get a bit more familiar with it. And alongside that, we were quite fortunate in that Mental Health First Aid England were busy working and developing online versions of their courses, which again, national organisation, but we'd never thought we would need those things in the way that we did. So we got familiar really with those products and got ourselves in a position that we could start training and delivering them. And I think now it's probably quite a significant proportion of my delivery. So I can't remember the last week that I didn't deliver a mental health first aid course now. I think it was something like November, December last year, apart from when I was on holiday. So it's been quite a constant thing, and there's obviously a lot of demand for those things. It's a real mix of some people who've been furloughed and they're looking for something to upskill themselves. Also, organisations recognising that they're going to need perhaps some more support, but also residents and individuals who are either trying to support friends, family members. Also, with the youth mental health first aid, we're getting a lot of parents coming on who are struggling because of the pandemic and wanting to find how they can better support their children going forward. So that's been a large part of our work. We've also run some stress and anxiety workshops online as well. And more recently, we've been fortunate, we have been able to get some of the outdoor courses that I run, so things like the gardening and the walking photography groups. We've been able to start those back up, and that's been really nice because I think a lot of people have been very isolated, feeling quite lonely. And for many people, it's those social aspects of actually just being able to get back into a COVID secure environment where they can actually do some learning and things like that. So yeah, we've been busy. We haven't really stopped.
Fantastic. So obviously all of these courses that you're running, they are open to the public and they are open internally for staff that work within the council, which I think is great. I managed to take some of your courses as a member of the public living within the borough, but obviously now as I'm part of a member of the team within the council, I've been able to take and be part of those courses as an employee as well. So it's nice to see both sides of them. Now, out of all of the courses, which is your favourite and why?
Oh, you've put me right on the spot there. I think so, certainly for the mental health first aid courses, I think all three of them are actually really good in their different ways. The mental health first aid awareness is a really nice one in that it's broken down into 3 2-hour sessions online. And it's a great resource and tool, I think, for people who perhaps just don't really feel that they know very much, that they want to support others, but they're not quite sure where to start. And it's an introductory course. So we see lots of people come and do that, and then they come on and they'll go on and either do the youth mental health first aid or the full mental health first aid because they discover that there's more there that they want to learn from that. So I think that's a really, really nice one. And I think probably aside from that, the walking photography courses have been really nice in that it's given people an opportunity to learn something that's a bit of a distraction, a chance to kind of just get away from everything. We've got some beautiful places in the borough. We're really fortunate that we've got some fantastic places to go and some really unexpected places as well. Just yesterday, I was out with a group in Darwin, and actually, although we'd planned the original route, the route took a little detour because one or two of the learners actually wanted to show me some parts of Darwin that I'd never experienced, and was able to hear all about the history there and things like that. So a lot of our courses, they're quite social learning. It's not necessarily about me being the complete expert. Actually, it's about learners having the confidence to come and talk about their experiences, but also to be able to share their knowledge and things like that, because we know that that aspect of it, and this links back to the 5 ways, doesn't it? It's an opportunity to give, it's an opportunity to connect. People are being active, they're learning something new. We've ticked off nearly all of the 5 ways just in a 2-hour activity. So I think that's really good and really positive as well. So the thing I like most about my job is that no 2 days are ever the same. So I think the variety in the courses sort of complements that really well, and it actually means that I enjoy most of what I deliver. I'm really lucky that way.
Fantastic. That's nice to know, and obviously great to share. And if anybody does want to take part, they can just go to the Blackburn with Darwin Adult Learning website. The
Yeah,
catalogue's on there, and they can just sign up to any of the courses.
yeah, yeah. Anyone who lives or works in the borough, the bwdlearning.org is the place to go first of all, or you can drop into one of the learning centres now. We're COVID secure, and both Audley Neighbourhood Learning Centre and Banktop Neighbourhood Learning Centre are open, so you can always pop in and get some information there. And also our National Careers Service, obviously you can access courses through there if you're not quite sure what you want to do. They've got information on all the range of courses there. That's a little plug, sorry.
So there's loads of resources out there, definitely, like you've mentioned, which is great. Now, with regards to Men's Health Week, would you say there's still, or do you feel that there's still a stigma around men and mental health?
Yeah, there's still I think for me, and this is from my personal perspective, I've obviously had my own experience in mental health, and I've probably in one way or another worked in and around mental health for 20 years. And I think from my perspective, that stigma is starting to reduce. And we are seeing, and I think particularly in the younger generations, they're much more aware of mental health than I ever was when I was growing up. Um, but that stigma is unfortunately still there. It may be reducing and we may be getting better, but there's still work to be done. And we know that that has a huge impact on making people feel incredibly isolated, being reluctant to come forward and admit that they're struggling and get some help. So I think we have to continue on with that, and we have to continue sort of combating that, and particularly for people sort of in minority groups, whether that be sort of ethnic minorities or from the LGBTQ plus communities. It's really, really important that we recognise the impact that that stigma and discrimination has on those groups as well, and how that makes life more difficult for people. And I think sort of in a pandemic that can't have been helpful either. It must have made things harder for those groups as well. So there's always, I think, going to be work to be done. And I think it's positive that it is improving, but we still need to keep getting that message out there and making it acceptable, particularly for men, to feel that they can come forward and say when they're finding things difficult, when they're struggling.
Yeah. Yeah, definitely. So with Men's Health Week and Men's Health Forum, they actually published some figures. And since 2019, the amount of suicides in men has actually increased, and it's been at its highest rate. What do you think the reasons kind of behind that are?
I think a lot of the reasons for men have been around not feeling able to be open and honest and talk, perhaps not knowing where to go and get support, even though we do know that there is support out there. I think men don't always recognise until maybe it's too late that there is support there and that they can go and access it. And there's lots of different ways in which they can go and access that support now, whether it's via text message, online, email services. We hopefully know about Samaritans, but there are other organisations such as Calm or Papyrus that are out there that are keen and wanting to support. We've also got locally now the Orange Button scheme, where people who've had some form of suicide awareness training can wear a badge now to indicate to people that actually there's somebody that you can approach. And I think also it's still a taboo subject. And whilst it remains a taboo subject and people are scared to ask people if they're feeling suicidal or they're struggling with things, it's also very hard then for people to admit to somebody that they're struggling. And I think that is more so with men. We still have that traditional sort of stereotype, and the man's got to be the breadwinner and the big, strong sort of alpha person. And therefore things get bottled up and people don't want to admit that they're struggling at that stage. And I think the pandemic's probably made that more difficult with things like furlough, with redundancy. Also, don't forget, men traditionally perhaps have been used to meeting in the pubs, used to meeting at big sporting events. All those things have been stopped. And I think that's not to say that it hasn't been difficult for women as well, because it definitely has. I think perhaps those were the places where guys could have those conversations, down at the football match or in the pub, or when they're out playing sports together. Those are the kind of vehicles where I think perhaps men do feel that they can speak up and things like that. And again, we're really lucky in the borough. We've got some fantastic initiatives around that. So the guys down at Creative Football down at Witton is a fantastic place where people can feel that they can go, have a kick around, but also get that kind of peer support, and it be okay to open up and talk. It's an amazing project, and I think they're doing some great things, and they've worked so hard, even in the pandemic, doing taking guys for walks one-to-one when they couldn't do group activities. They've been really innovative and found ways to still work safely but carry on that. And it's just about us kind of continuing to do that and provide the right forums for men to feel supported.
Yeah, Excellent. And obviously, moving forward, I know you're obviously in the Blackburn Withdrawal and Adult Learning, so you would recommend for people to jump on one of the courses. I would definitely recommend it. It was one of the best things that I did throughout the pandemic last year, moving into this year. But what would you kind of give as like a top tip or a little bit of advice to any other male colleagues or any other men out there that might possibly be struggling?
I think the biggest thing for me is I think as I've sort of got older, I've definitely become more in touch with my sort of my emotional literacy. So what I mean by that is I'm much more aware now when I'm struggling. Okay, when I was young, I had some issues around anxiety. I didn't even know what anxiety was, let alone the fact that what I had were absolute classic symptoms with panic attacks, not being able to go out, feelings of real fear and dread of work and all sorts of things. And I think the biggest thing for me is I've learned now what the indicators are if I'm starting to struggle, and also what coping strategies I can use. What are the things in my locker? I love the video earlier in the week of Ryan because he kind of talked about using the gym, but then also recognize that we have to have more than one thing in our locker. So my go-to is running. You might not think it to look at me, but then I had about 6 months, 2 years ago, where medically I wasn't allowed to run. And it was a real challenge in that I had to sort of start thinking, okay, well, it can't just be about running, because if it's just running and I can't run, that leaves me in a real difficult spot. So it was then about learning what else works for me. And certainly things like photography, getting closer to nature, were things that worked really, really well for me. But also listening to music, or even just recognizing that I need some sort of self-care time where actually I'm just going to, even if it's picking up a computer game and just having a bit of a blast, whatever it is that kind of works for each individual. And no two people are going to be the same. So I'd never prescribe everybody needs to come for a run with me, because I think for a lot of people that'd be horrendous. But find what works for you and know that you've got it in your locker and it's something you can turn to if you're struggling. I think that for me would be my number one tip, is just kind of getting that bit more in touch and recognizing the peaks and troughs. We all have them all the time. Whether it's through working life or personal life, we're all going to have that life experience of good days and not so great days. And it's about us recognizing when those days aren't so great and it's starting to impact on us, and just thinking, well, okay, I know actually when I'm feeling like this, the thing that helps me feel a bit better, and that's then knowing that that's there and we can access it and we can use it to support ourselves. And I suppose an extension of that is recognizing when we really do need perhaps some external help. A few years ago, I did reach out to the employee wellbeing scheme because I was really struggling on a project, and wherever I turned, I didn't seem to be making any headway. And again, it's just about recognizing the fact that we're struggling and what support we've got.
Yeah, we're very lucky in the council that we have that employee support. We have some external resources that we can go to. We have fantastic management within the council that we can go to, which is another option. We have a HR team. So internally, I think the council really does kind of cover employee wellbeing excellently, really. For people that are obviously within the borough, we are trying to promote different services that we have. There will be a link just at the bottom of this video as well, where we are going to promote those external resources, because like you said, there is help and support out there. So excellent. Thank you so much, Chris, for your time, and thank you for coming forward and helping us making one of these videos for Men's Health Week. I'm sure it's going to help a lot of people, and hopefully we'll see each other very soon, and we'll be working closely together as well, and I'll definitely be signing up to another one of your courses.
Fantastic. Thank you very much for inviting me, Lucia, and thanks for the conversation.